Let's talk about a patient who suddenly becomes hypotensive on your medical on-call shift. So if you look at them being newly hypotensive, check the news score, check whether they were hypotensive in the past, and if they're newly hypotensive, do they have a new oxygen requirement and are they tachypnic? If they have a new oxygen requirement with a faster breathing rate, it might be a chest infection. However, if they're newly hypertensive with a new oxygen requirement on top of heart failure, it might be an acute pulmonary edema. When giving fluids, check what their fluid status is, check what the ejection fraction of the heart failure patient is, because if their ejection fraction is less than 40-50%, you might be wary of giving a bolus because it might exacerbate an acute pulmonary edema episode. Also, if they're newly hypertensive, repeat the blood pressure in the other arm. Which arm was the blood pressure measuring in? Maybe the reading was wrong. What are the causes of low blood pressure? So, there can be cardiac causes and infectious causes. Cardiac causes include aortic stenosis, which is the aortic valve narrowing, which will reduce the cardiac output. There can be cardiogenic shock, which may occur following a cath lab procedure, or cardiac tamponade, which may occur following a cath lab procedure. Cardiogenic shock would imply pump failure and pericarditis. Infection can also be a source of low blood pressure, which would be sepsis as a cause of the hypotension, which would lead to a tachycardic heart rate and a high temperature, with toxic shock and meningitis being another differential. So is it an acute drop in blood pressure, or is it chronic? If it's acute, it would suggest shock, bleeding, or a cardiac cause. Which symptoms are present? If there's chest pain, it might be MI, PE, or aortic stenosis. If they have low blood pressure plus a temperature like fever, it might be sepsis, and syncope would suggest vasovagal,